So, hello guys, hello everywhere. Good day everyone. This is a presentation from Professor E.Nazarov, and I'm a scientific secretary. My name is Victoria, so I will perform this presentation. And the topic of this presentation is medical gases as a tool for integrative medicine, theory and practice of ozone and xenon therapy. The presentation covers the following topics. First, on the example of homeopathy and pharmacology is revealed the fundamental difference between the approaches of modern and integrative medicine. There is revealed the physiological meaning of the main principle of homeopathy, simile sibilibus curantur, as one of the most important branches of integrative medicine. Condition reflex homologous as the main principle of medical gas therapy. So based on this principle, we explain why ozone therapy is a pathogenetically justified method for the prevention and treatment of disease caused by virus SARS-CoV-2. And finally, the fourth part outlines the practice of correct calculation of integrative therapy course to achieve adaptive rejuvenation. So the history of the philosophy of European medicine can be roughly divided into two stages: Galenian, 2nd to 15th century, and Cartesian from 17th century to the present. Although Descartes was not a physician, but his idea of the dualism of mind and material created an ontological space for modern medicine, separating body from mind. The mind is superior to the body because it represents the uniqueness of the human soul. As a field of theology, the body is inferior to the mind because it's just a soulless material. And Cartesian medicine simply considered the body as a machine. And modern medicine, despite all its outstanding achievements, in fact is a Cartesian mechanistic science and practice. So, Cartesian methods already in the 17th century began to demonstrate its inconsistency. As the famous comedian Molière noted, people almost always die from drugs and not from disease, and medicine and one of the greatest delusions of the humanity. So currently modern medicine, following the Descartes principles about the victory of mind over material, has turned a human being into a consumer of pharmaceutical products. The backside of pharmaco and chemotherapy is a continuous increase in the number and severity of drug diseases. For example, according to the World Health Organization, around 30% of patients suffer from drug-related ailments. In other words, we heal one organ and we cripple another. So since the middle of the last century have begun attempts to revive pre-Cartesian ideas about the disease reason and the methods of their treatments, relying on the modern level of development of physiology, biochemistry, and other sciences. The innovation in medicine is called the integrative method. This method is based on the principle of holism. The term holism comes from the Greek language holos, which means global or entire. And the motto of holism, the entire is bigger than the sum of its parts, which goes back to the metaphysics of Aristotle. Holism consists in consideration of all parts of human body in their relationship and interdependence. So the basic methods of integrative medicines are homeopathy, homotoxicology, traditional Chinese, Vietnamese, Tibetan, Korean medicine, color and aromatherapy, hirudotherapy, acupuncture, traditional Oriental pulse diagnostics, and osteopathy and manual therapy. Integrative medicine is understood as a big variety of direction of traditional medicine from Asia, which we mentioned before, and some European origin, which is homeopathy, homotoxicology, and osteopathy. If we refer to Wikipedia, we will see that all of these methods, and even acupuncture, are considered as anti-scientific. If alternative Wikipedia existed, we would have criticized the modern therapy direction in the same way. Meanwhile, mutual understanding between representatives of traditional and integrative medicine is possible based on the new methods which I will outline below. For example, consider pharmacology and homeopathy. The first direction is based on the power of modern achievement of chemistry, biochemistry, genetics, and the second on archaic concepts like similarity, dynamization, potency, miasm, vital force remain unchanged for last 2 centuries. It seems that pharmacology and homeopathy have nothing in common. However, it's not that true as it seems at the beginning. So let's start with one of the most important factors to use medicine effective dosage. Homeopathic remedies are used in low doses and their dose response curve located in the area of very low doses. For example, this slide shows the dose response curve for bone caries, eye diseases, atherosclerosis, and hypertension. Other metal drugs also show the same dose response dependence. This curve you can see on the table is typical for substances called hormetics. So the hormetic nature of the dose response curve is common spread fact. On the slide we see examples of this hormetic effect of morphine on phenyltrazole convulsions in red, sodium and arsenate on the activity of phytohemagglutinin activated lymphocyte, the hemotherapeutic properties of anti-tumor, cytostatic, or even ethanol on the social activity of humans. So, moreover, the hormetic effect is observed even among the plants. This is clearly seen from the example that we shown on this slide of this effect of various dilution on the natural phytotoxin parthenin of the growth of the house plants. So for further presentation, it is important to note that all substances on the previous slide, morphine, sodium, arsenate, ethanol, and cytostatic, is that they all belong to the category of poisons. So now we will see the hormetic effect of these two medical gases, ozone and xenon. Among the medical gases, the hormetic effect has been repeatedly confirmed for ozone and xenon. In this way, we can bridge the gap from the field of homeopathy, which is completely ignored by modern medicine, to the field of the scientifically recognized hormesis phenomenon and the hormetic properties of medical gases. In order to understand the difference between classical pharmaceuticals and the hormetics, let us compare their dose dependence. So, as can be seen from the figure, the dose-answer curves of therapeutic and toxic effects for classical drugs are spaced along the dose scale. You can see now here we are showing on the slide by a considerable distance. Thus, the therapeutic and toxic effects of the drugs don't overlap. So, at the same time, the dose-effect curve of the toxic and therapeutic properties of hormetics is located in the same dose range, and the therapeutic effect is a negation of its toxic properties. From this follows the only one explanation of the phenomenon of hormesis. Intoxication with the hormetic of the low doses cause a powerful defense reaction of the body, which overpowers the toxic reaction and provides a therapeutic effect. At a certain dosage, the toxic and protective effects are compared, and with a further increase in the dose, the hormetic behaves like a pure toxicant. The hormesis effect is the best illustration of the expression of the founder of pharmacology, Paracelsus. So, all things, substances are poison, and there are nothing that is not poisonous, and one dose can hide it away. In this expression, there is no word medicine, but the German word Gift, which means poison, occurs 3 times, which makes the popular translation everything is poison, everything is medicine, both depends on the dose, is completely wrong. So, which conclusion we can make in between? The first conclusion is that therapeutic effect of some homeopathic remedies is determined by the hormesis effect. Thus, in a first approximation, the term homeopathic remedies and the term hormetics can be considered synonymous. The therapeutic effect of homeopathic preparation is produced by the organism as a result of the development of the protective reaction to intoxication. In this case, the effect of classical pharmaceuticals and homeopathic remedies is fundamentally different. The first have their own therapeutic effect, and the other simply causes a protective reaction of the body, which can be pathogenetically reasonable for the treatment of a wide range of diseases. So the main principle is physiological scent of the main homeopathy principle that we mentioned already once, similia sibilibus curantur. So let's go more detailed about this principle. In order to understand the proposed scheme for the implementation of the therapeutic effect of hormetic drugs, it is necessary to find out the following details. How does the body form a protective effect for any poison used in treatment? And how is the protective reaction consolidated after the completion of the course of homeopathic therapy? We took medical gases, ozone and xenon, as the object of our research of the hormetic action. So why do we choose exactly ozone and xenon as the research object? First, because ozone is very similar to homeopathic medicines in terms of the hormetic shape of the dose-response curve in a wide range of pharmacological activity. And the second, they have been fairly well studied by modern clinical and biochemical methods. Thirdly, they are the representatives of medical gases family, which, as can be seen from the table, are poisons. So we gather therapeutic and toxic properties of ozone in the table. For more clearness, the type of physiological action is indicated by arrows showing the movement of these characteristics from the normal level. As you can see, the direction of the arrows in the toxicity and therapeutic properties table is shown mirrored. That means that the therapeutic effect of ozone is the body's protective reaction on its toxic influence. The same explanation can be applied to the table of the therapeutic and toxic properties of xenon. So before we show you ozone influence, and this table is xenon influence. So the same explanation can be applied to the table of the therapeutic toxic properties of xenon, and the chemical properties of ozone and xenon are completely different. So the first is the strongest oxidizing agent, and the second is an inert gas. Considering this, we can say with confidence that unlike classical pharmaceuticals, the homeopathic effect of a drug doesn't depend on its chemical properties, and it's determined only by the type of its toxic effect on the body and the main therapeutic result of the use of hormetic drugs in the opposite of its toxic effect. This is a physiological meaning of the hormesis phenomenon in general and the physiological meaning of the aphorism similia sibilibus curantur for drugs used in homeopathy. So, medical gases and unconditioned congenital homeostatic reflex we took and we will show it on example of ozone and xenon toxicity. So, the dichotomy of health and disease can be understood as a norm and a deviation from the norm. So, is it real to form or conditional reflex to maintain health? Considering this, the question we can rephrase as follows: is there an innate reflex to maintain homeostasis? Yes, there is, and here are some forgotten examples. So, first example, the development of the conditional hypoglycemic reflex based on the unconditional reflex of maintaining the concentration of glucose in the blood by the followers of the author of the higher nervous activity theory Pavlov, were proven that repeated glucose infusion to a dog leads to the formation of a paradoxical condition hypoglycemic effect based on unconditional reflex of maintaining the norm of glucose in the blood. So let's illustrate the formation of this reflex. We took trade scales. First figure showing, let's say that the arrows corresponds to the normal blood glucose level. Second figure, glucose infusion increase its level in the blood. So here you can see. And the third figure showing the reaction to glucose increase, insulin level in the organism raises and the glucose concentration is lowering. The fourth figure showing us the imitation of glucose infusion as a physiological saline solution to animals lead to conditional reflex of insulin formation and it decreases glucose level in the blood. So, second example showing us the conditional hypotensive reflex based on a congenital unconditional reflex of stabilization of blood pressure by autonomic nervous system. Another example is the realization of a paradoxical hypotensive conditional reflex to adrenaline. In this case, the conditional reflex is developed based on the innate unconditional reflex of maintaining the blood pressure norm. I use this example in order to demonstrate that an unconditional homeostatic reflex can be realized in the neurohumoral ways. And the third example showing us a conditional diuretic reflex based on a congenital unconditional reflex of stabilization of the water cell balance. The next example concerned the formation of a conditional reflex on the basis of an innate unconditional reflex to maintain water cell balance. The essential sense of the experiment is that in the beginning we input several times portion of water into the dog's stomach, what activates the innate unconditional reflex in the kidney's function to discharge extra liquid from the blood. Further, the insertion of a portion of water in its rapid removal also causes the unconditional reflex activation of urine excretion. So the fourth example showing us the conditional reflex of hyperactivity based on the unconditional reflex of maintaining a normal level of psychosomatic reactivity. The previous examples were based on a usual unconditioned reflex to maintain somatic homeostasis, but at the same time it is possible to form a conditional reflex based on the innate unconditional reflex of maintaining the norm of psychosomatic reactivity. So this figure shows us an example of of a conditional reflex reaction of hyperactivity as a reaction to the toxic effect of chlorpromazine. Last example finally shows us a conditional reflex of the immune system based on the innate reflex of maintaining the antigenic constancy of the internal environment of the body. So, there is an example of conditional reflex reaction based on the unconditional reflex of maintaining the constancy of its internal space, and the animals were injected intraperitoneally with sterile talc, which activate the conditional immune response of talc rejection through the immune reaction of mononuclear cells secreting intraperitoneum. Imitation of such insertion by intraperitoneal injection of saline solution also leads to the emerging of mononuclear cells in the intraperitoneal liquid. So what are the next conclusions we can do from these examples that we show you? First, that the reflex maintaining homeostasis to any effect, including drug and toxic, exists, and in the same time the real unconditioned reflex as a congenital reflexes of thermorelation, cardiac, respiratory, and vascular. The second is a homeostatic reflex is a universal tool for correction of any disorders of the psychosomatic state of the body. Next conclusion is a continuous repeat of the effect of disturbing homeostasis leads to an unconditional fixation of the condition of the external and internal environment accompanying the violation of homeostasis. In the above example, an injection in the stomach, sprain, etc. When repeating one or more of these conditions, the body develops an anticipatory reaction, which is the reverse to the effect of a damaging factor. So thus, the unconditional homeostatic reflex becomes conditional, and from the dichotomy of a norm health, deviation from the norm, the disease implies that the homeostatic reflex is a reflex healing. So with the above data, we explain and proved the existence of endogenous and mechanism capable to activate the homeostatic reflex in case of violation of any homeostasis parameter, and their activation under the action of two medical gases, ozone and xenon. How are these endogenous mechanisms activated and realized? It is known that the neuroendocrine system plays a very important role in the formation of conditional reflexes. Below we will demonstrate that the explored gases activate the proendocrine system. So the role of the neuroendocrine system is the formation of the homeostatic reflex, homologous instead of hormesis. Here below there are presented literature and own data showing the explored gases activate neuroendocrine system. So we are showing here that ozone intoxication causes an immediate rate of corticosterone, which in the organism of rodent animal functions as cortisol. This increase can be blocked by an inhibitor of corticosteroid synthesis in the adrenal cortex. So comparison of transcriptional responses to ozone and exogenous corticosterone. Therefore, corticosterone suddenly enhances the synthesis of a number of transcription factors for the synthesis of messenger of the most important bioregulators caused by ozone intoxication. Thus, the physiological reaction to ozone is related to endocrine system, and this shows us by an evident decrease caused by ozone intoxication, an example of the mortality of animals whose adrenal cortex has been removed. That's known that the therapeutic and toxic effect of a drug are closely interrelated, so therefore it can be assumed that corticosteroids also act in the therapeutic effect of ozone. So normalized level of cortisol in the blood of 6 patients. We took people from 41 to 64 years old in control during the course of autohemotherapy O3 procedures and within 2 months after completion of the course. So indeed, the effect of ozone of the level of cortisol is presented even at the lowest doses, and ozone is used in ozone therapy. It's very significant and important that the level of cortisol fluctuates during the course of ozone therapy procedure. This indicates that the complex process of adjusting the hormonal status corresponding to the formation of the correct protective reaction to ozone intoxication is going on the neuroendocrine system. So this slide shows us an example of the dynamics of two adrenal cortex hormone, glucocorticoid cortisol and mineralocorticoid aldosterone, during the course of ozone therapy. Multiplied changes of aldosterone level are especially indicative, demonstrating intense changes in endocrine system performance with regular ozone intoxication. And xenon also has a strong influence on the endocrine system in general and the two adrenal system in particular. So the research was held on a group of healthy people aged from 18 to 40 years old. Blood was taken for analysis for 60 minutes. After the end of the short term, around few minutes, inhalation of xenon oxygen mixture, half to half. During the course of ozone therapy, leukocyte concentrations and heart rate variability parameter is changing. This indicates that the autonomic nervous system is also involved in the system reaction to the introduction of ozone in the blood. So, thereby we see that the course of ozone therapy activates three subsystems of homeostasis: nervous, endocrine, and immune. The main role in the body defense reaction to intoxication with any poison is presented by the endocrine system. Therefore, we propose to use the term homologous, derived from the Greek language, which means hormone set in motion, activating of hormonotropic action of and oligos, which means small amount. This term seems to be much more successful than the term hormesis, since it focuses on the fact of hormonal regulation of the body's defense reaction to the action of the small doses of the toxin. So, how does the neurohormonal system form a protective effect of ozone intoxication? So here we propose the following diagram to illustrate the mechanism by which the homeostatic effect is realized, as well as how hormetics interacts with this mechanism. The inner circle, on which the endocrine glands are indicated, is covered by a system of humoral connections. The outer circles represent the mutual relationship system of the central and autonomic nervous system. The ratio of the strength and positive and negative connection determines the innate rate of metabolic reaction of the body. Violation of this norm by toxicants, for example ozone and xenon, automatically changes the ratio of positive and negative connection in the system, which returns metabolism to the normal level. We call this effect innate homeostatic reflex, which appears to be the therapeutic effect of the gases of the homeopathic remedies. So we believe that the answer to this question is that the endocrine system has a full complex of hormonal agents and that can imitate any known pharmacological ozone effects. A simplified scheme for realizing the main therapeutic effect of ozone by manipulating the patient's hormonal status is shown on the slide. For example, so here you can see that we are telling before that to develop homeostatic response to ozone to improve blood rheology, the adaptation system can activate the synthesis of renal erythroprotein, adrenal norepinephrine, and cardiac natriuretic peptide. Accordingly, adrenal cortisol and aldosterone or vasopressin can be used to compensate for the anti-inflammatory and vasoconstrictive component of ozone toxicity. The specific choice of a set of hormonal defense reaction tools is carried out in the form of a series of a trial and error, as can be seen from the dynamics of hormone levels during the ozone therapy procedure. So how does this concept correlate with experimental evidence of changes in the level of so-called markers of oxidative stress? The concept of homologous doesn't ignore the participation of the antioxidant system in the complex protective reaction to ozone intoxication. Just within the framework of this concept, we move the accent from the antioxidant system to the endocrine system as the leading one in the organizing the body's defense reaction. This is also reflected on the diagram on the side effect. So let's go through the Pavlov's conditional reflex homologous at the basis of the systemic therapeutic effects of medical gases. So the concept of homologous should be supplemented with a mechanism of continuity of the protective effect, since we know from practice that the result of a course of ozone therapy is a long-term remission of a wide range of disease. This problem is solved in a natural way, proceeding from the possibility of a conditional reflex homeostatic reaction to any factor disturbing homeostasis, including a toxic factor such as ozone and xenon. In other words, a course of ozone or xenon therapy, which is mainly a course of regular intoxication of a patient with ozone or xenon in a subtoxic concentration, is essentially a course of developing a conditioned protective homeostatic reflex. So following the concept of Pavlov's conditional reflex of homologous, the above described oscillatory change in the level of hormones during the course of ozone therapy or xenon therapy is a reflection of the formation of an adequate homeostatic reflex, which, as mentioned earlier, has a complex neuroendocrine immune nature. With this successful formation of the reflex, the body goes into a state of a long-term anticipated protective reaction to the action of the toxicant, which consists in improving blood microbiology, expanding capillaries, developing anti-inflammatory and immunomodulatory effects, improving mood, activity, optimism. That is everything that we call therapeutic effect of ozone and xenon. So the concept of Pavlov condition homologous for ozone therapy is that ozone causes and fixes a conditioned reflex reaction, which is an advanced adaptation reaction opposite to its toxic effect. This reaction is a universal reaction of the body to any type of poison. So why do we choose medical gases? First, the ozone and xenon don't accumulate and their effect is reversible in the body, unlike many other poisons. And the second, because they are components of the body's detoxification reaction to ozone and xenon, are pathogenetically justified for the treatment of a very wide range of disease. So hereby the improved concept of Pavlov's conditional reflex homologous and the theoretical justification for the use of toxicant in an integrative medicine has three sources and three components. The state that there is a factor that allows to hide the toxic properties of the substance. The state there is a factor affects the organism, has an effect opposite to its toxic one, and the discovery of innate reflexes of normal or homeostatic reflexes and the possibility to fix them in the form of conditioned homeostatic reflexes. So, to test this hypothesis, we use the methods of focused magnetic brain excitation in various combinations with the systemic use of ozone. As an indicator of the state of homeostasis of the patient body, we choose blood leukoformula. The choice of this indicator seems to be much more successful, and since the relative level of leukocytes sensitively reflects the hormonal and immune status of the body as well as general condition of the patient. So to test this hypothesis, we use the methods of focused magnetic excitation of the brain in various combinations with the systemic use of ozone. As an indicator of the state of homeostasis of the patient body, we choose a blood leukoformula. The choice of this indicator seems to be justified since the relative level of leukocytes sensitively reflects the hormonal and immune status of the body as well as the general condition of the patient. As an indicator of the deviation of integrative homeostasis from the norm, we used the tension parameter of the adaptive blood reaction, which is described by a function depending on the percentage deviation of monocytes, eosinophils, basophils, and the stop neutrophils from the corresponding norm values, taking in considering these also the weight coefficients. For the value of the norm, the value adopted in the sensitives of the last century are taken. The studies were carried out using the O3 software available on the internet. So the next slide shows us the dynamics of leukocytes during the course of ozone therapy. The gray area on the graph on the left show the 5% deviation from the norm. The abscissa show the dates of the extracorporeal blood ozonation procedure. On the right, there are values of the tension of the adaptive blood reaction, which is indicated by violet line, and the values of the adaptation age calculated by the leukoformula, which is red line, and the psychotest, which is a blue line, built into the program. It can be seen that during the course there is a drop in the tension of the leukoformula, which means that the achievement of hormonal balance. At the same time, the adaptation age of the patient, calculated according to the leukoformula and psychotest, is sharply reduced. On average, such a result is observed in a quarter of patients, but this value can be raised to the 3/4 by conducting the so-called correct courses of ozone therapy. The methods of obtaining the effectiveness treatment is described on the website of our O3 Navigator program. So the idea of the experiment to test the hypothesis consisted in use of some non-chemical factor which is no longer a drug effect would affect the parameters sensitive to the ozone action. A focused electromagnetic effect on the brain deep structures was chosen as such a factor. This choice is based on scientific work of Professor Rusinov, who showed that the production of conditioned reflexes in animals is accelerated several times when the brain is stimulated with a transcranial magnetic field. For this study, we use this blood Leuko formula. So let's go explain. Let's explain what does mean. Researchers on magnetic stimulation of the human brain have been held since the beginning of the last century, and at the moment, magnetic excitation got a large spread of the diagnosis and treatment of psychiatric diseases. Based on the concept of homologous, we have developed and certified the device for this procedure, transcranial focused magnetic brain excitation. The construction of the device is designed to focus the magnetic field in the area of the prefrontal cortex, where are concentrated dopaminergic learning and reward systems. So here on the slide you can see this installation for ozone-hydrogen therapy on the basis of deep stimulation of the prefrontal cortex and limbic system on the brain. Here below there are links that you can go through and look this video, watch on the YouTube channel. So nowadays, this device, initially developed for research purposes, is widely used in our clinic in combination with ozone-hydrogen therapy of extracorporeal processing treatment of large volume of blood. So you can see on the figures how this procedure is held. So the above graph shows the first example of using this installation. The procedure lasting around 20 minutes with an intensity of the 6 series of 20 pulses per minute were prescribed to the patient after the usual ozone course of ozone therapy in the form of 7 procedure of infusion of ozonized saline solution. The patient required treatment for depression. At the end of the course, the patient was unhappy with the results of the treatment and insisted to continue the course of procedure. However, according to our experience, at the moment the formation of the conditional reflex reaction was completed, since the oscillatory dynamics of the Leuko formula stopped. And on the graph you can see this area that refers to the end of the bold green line. The patient's dissatisfaction corresponded to the absence of the significant decrease in the adaptation age according to psychotesting data, which is indicated by a blue line. Regarding to the patient was offered to undergo a course of BMS procedure. 4 procedure of magnetic excitation completely changed the adaptation age of the patient according to the data of psychosomatic testing, but practically did not affect the calculated adaptation age according to the Leuko formula. That's important to note that magnetic excitation of the brain was accompanied by a sudden fluctuation in the level of leukocytes, which was quite unexpected, and such fluctuation of the Leuko formula without a significant decrease in the adaptation age according to Leuko test we notice in the future with each course of brain magnetic procedure. Based on these data, we began to conduct these procedure courses simultaneously with ozone therapy courses. So here you can see the graph on the left show an example of this procedure effect on the indicators of the effect of physical state of role functioning and life activity of a group of healthy people, volunteers aged from 51 to 65 years old, according to the questionnaire for assessing the quality of life. It can be seen that the effect of 3 procedures within 3 days on this correlates of the well-being of healthy people is strong but unstable and almost completely disappears within 1-2 weeks. The joint implementation of this procedure and together with the infusion of ozonized saline solution creates a persistent effect of improving the quality of life according to the parameters of the effect of physical state and life activity for many months, for a long time. So we can make the following conclusions, that the magnetic excitation of the deep brain structures and the prefrontal cortex essentially affects the parameters of blood glucose formula, considering a lack of trivial connection between the brain and the white blood system from one side and a proof effect of the hormonal system on the white blood on the other side, means that this brain magnetic procedure triggers and launches the adaptation mechanism of the neuroendocrine system. An introduction and performing of magnetic excitation procedure increase the effectiveness of ozone therapy, reducing its direction by at least a half, while maintaining the usual duration of delayed therapeutic effects of ozone. Considering that these procedures themselves have only a short-term therapeutic effect, we conclude that the synergy of ozone and the big procedure of big volume of blood intoxication lies in the previously described acceleration of a magnetic stimulation in the formation of conditional reflexes. Thus, the experiment confirmed the role of conditional reflex in the mechanism of ozone action. And an additional argument in favor of concept of Pavlov's conditional reflex homologous is the long-term practice of using treatment methods based in our educational and methodological center of our Econica Medical Engineering Enterprise, which is located in Odessa. So the next part of our presentation is dedicated to the practical use of Pavlov's conditional homologous reflex for the treatment of patients infected with the SARS-CoV-2 virus. So you can see on the slide one of the most important elements of pathogenesis of COVID-19 is a blood hypercoagulation developing as a result of multiple blood coagulation disorders. So in this slide there is a table that shows us the scale of hypercoagulable blood disorders in patients with the COVID-19. To treat this disease, following new methods, we have to induce a protective anticoagulate reaction of the body. For this, it's better to use intoxication with a subtoxic doses of ozone because ozone selectively interacts with the hemostatic system. In the therapeutic concentration, the course of ozone therapy causes a persistent hypercoagulation state that lasts for several months. A specific method of ozone therapy for this purpose is intravenous infusion of ozonized saline solution, since this method allows the entire volume of circulating blood to be processed in one procedure. So the dynamics of the manifestation of symptoms of the disease caused by SARS-CoV-2 virus during the treatment with ozonized saline solution of 40 patients in Central Hospital of Tbilisi. This is an example comes from Georgia. As we can see from the graph, main symptoms of the disease have disappeared within a week. And this slide shows us the results of the dynamics of biochemical parameters after the beginning of the infusion of ozonized saline solution. The abscissa shows the days after the start of the ozone therapy course. The results are borrowed from the article of this Professor Sharma, Shah, Lakshmi, and so on. So you can see a pilot study for the treatment of COVID-19 patients in moderate states using intravenous administration of ozonized saline solution. So he will demonstrate you the examples of treatment of patients with these methods, prevent the development of severe forms of the disease process, which can be seen from the example of computer tomography presented on the slides below. He will show you next examples. So here you can see that also our enterprise of Konica Medical Engineering has also developed and certified a special device, Bozon-N which you can see now on the slide, which allows the preparation of ozonide physiological solution with ozone concentration in saline in typical therapeutic concentration. This device receives an ozone-oxygen mixture in 99.9% in terms of oxygen with a predetermined concentration in the range from 5 to 80 mg per liter from distilled water. The device weighs 2 kg and can be used to prepare and carry out procedure for intravenous infusion of ozonide saline solution both in the clinic and at home. The device is very useful and mobile. You can learn more about the properties of this device that we have here on the link on YouTube. So let's go through our Konica Medical Engineering software and hardware that we use for integrative medicine. So first we have our O3 Navigator program, which we use as a universal tool for monitoring integrative medicine course. So here we have created a screenshot program. It was created as a workstation for an ozone therapist, and it allows to the doctor to work with the patient database, a database of ozone therapy protocols, and perform operational monitoring of the patient condition during the course of therapy, as well as rational planning of treatment course by the method of intoxication with borderline doses of ozone. After the inclusion of xenon in the range of medical gases, as well as gaining an understanding that medical gas therapy is essentially a kind of integrative medicine. An O3 Navigator program has become a universal workplace for a doctor of a holistic medicine. So, for example, on this slide there is a screenshot of the database from our O3 Navigator program of the records in the medical history of one patient. In the rows of the records of medical history, in addition to the leukoformula data, there are fields with the data based on psychosomatic test and 12 more fields where we can keep data of any types of analysis. So the program has tools for graphical performing of the treatment course dynamics indicator and calculated results based on these parameters. For example, the adaptation age based on leukoformula or cardio-intervallogram, as well as built-in psychotest or test based on the SF36 questionnaire. So let's answer the question that is it possible finally to increase the efficiency of the integrative medicine methods to avoid use medical expensive and diagnostic equipment? Yes, it is possible using our O3 Navigator program, leukoformula of heart rate variety data, and the concept of Pavlov's conditional reflex homologous as a methodological treatment method. So, evaluation of the results of ozone therapy courses by patients on a 4-point scale. So you can see now the difference how we use with O3 Navigator and without. You can see on the graph. So understanding the nature of this reflex and knowing the features of its formation it is the key to immediate increase in the effectiveness of ozone therapy and other kinds of therapy with medical gases. Based on this concept, we created a method that shortens the course of systemic ozone therapy by 2-3 times and guaranteeing a psychosomatic uplift of the patient at the end of the treatment course. Also, the following this conception, we developed a simple method to evidence the effectiveness of ozone therapy. The general nature of all types of the holistic therapy allows to use O3 Navigator as a universal workstation for a complementary medicine physician. So now we will show a few examples of our equipment that we use for medical gases therapy. So the family of ozone generators Bozon-N includes 3 types of generators of ozone-oxygen mixture. We have different kind of these devices. There are Bozon-N, Bozon-N plus, and Bozon-N plus plus, which basically has a difference only in a level of automation and service. The most advanced version is the Bozon-N plus plus, which has in the program has an ability to preset the typical parameters of the procedure for the most common procedure with ozone therapy. In the hardware, it has an automated valve to switching the ozone-oxygen mixture and a vacuum pump that allow you to do vacuum massage with a high concentration of ozone in a vacuum jar, as well as it has also the Wi-Fi module that allow to use a remote control of the main components of the device. And here you have you can see our device which we use for cleaning and for home, which called the Bozon H2O3. You can see here that it has 2 options. There is a hydrogen function and ozone function. It's the world first and the only ozone-hydrogen generator with an internal source of oxygen and hydrogen. So here there is another automatic installation that we use for inhalation with noble gases. So device is designed for inhalation of 1 of 4 gas mixture. There are different medical gases that we use so far. There is a helium, argon, krypton, and xenon. So the transition from one type of breathing mixture to another is carried out by changing the gas cylinder. The type and composition of the gas mixture are set the initial dialog and are stored throughout the entire procedure. Inhalation are carried out according to a closed breathing circuit. Concentration of oxygen is at least 25% of inner gases in a given level. It is possible to preheat the helium-oxygen mixture within the range of from 40 to 90 grades Celsius. The device has a built-in cardiac monitor with electrocardiogram indication on the main screen. And there is another installation that we use for extracorporeal blood processing with the ozone-oxygen mixture. And this installation we call Bozon-N EBOO RU. The device designed for extracorporeal processing of large volumes of blood using a glass rotary membranous contractor. The volume of processed blood depends on the caliber and its use throughout the veins. The oxygenated red blood cells mass is mixed with ozonized saline solution and is infused to the patient. When using the cubital vein, the total circulating blood volume, it can be up to 5 liters. It's processed in from 2.5 hours. So this device has a precision ozone generator equipped with the ultraviolet photometer of ozone concentration, which guarantees the safe ozonation of blood without risk of overdose. So this device also can be used as a powerful general purpose medical ozone generator. So the methods of extracorporeal blood processing is approved for use in the territory Ukraine and Russia. The ozone concentration and gas flow are set and maintained automatically within the range from 0.1 up to 100 milligrams, and a gas flow rate from 0.2 up to 1 per minute. So you can see also the full video about this installation on our YouTube channel. So there is another installation that we mentioned also before, that is dedicated for deep stimulation of the prefrontal cortex and limbic brain system. So that was our medical equipment that we use for the medical gas therapy. We thank you for your attention. Thank you so much.